Oh, absolutely. Say no, it will not make you infertile. Again, it's the mechanism of the messenger RNA vaccine does not even enter into the nucleus of the cell. So it does not change the DNA of the particular cell. It's only on the surface of the cell. So there's no way that it would change any future fertility issues. No, you certainly should not. You should get your vaccine. You can have it prior to pregnancy or during pregnancy. And again, just recently, our American College of Obstetrics and Gynecology and the Society for Maternal Fetal Medicine both came out with guidelines recommending vaccination for pregnant patients as well as lactating patients. And then the CDC, again, confirmed that recommendation several weeks later in August. I mean, other than having what everyone's heard about, some of the particular side effects, low-grade fever, possibly arm hurting, maybe some aches for 24 hours, it's not going to hurt the pregnancy. The advantage of getting it during the pregnancy, of course, it will help protect you, but also it does protect the baby because the mom produces antibodies from the vaccine, which can be passed to the baby through the cord, which has been proven from blood studies from babies. And again, if they're lactating and breastfeeding, that the antibody does cross to the baby too in the breast milk, so it offers him protection where currently they can't receive vaccines. Yeah, it's called a thrombosis and thrombocytopenia syndrome. Actually, it's seen with the infection more so, and only the J&J or Johnson & Johnson vaccine had that happen with their as a side effect of the vaccine. And the messenger RNA vaccines did not have that occur. So if someone is concerned about that, they would prefer to get the messenger RNA vaccine instead of that adenovirus vector vaccine, which the J&J is. There's a binding receptor on the virus, and the immunity that's given from a vaccine affects multiple areas on that receptor, whereas the natural immunity from an infection only affects a small portion of that. So the thought is that you would be protected more from different variants with the vaccine as compared to just having the one type of infection. And that would only protect you from that particular subtype rather than any other subvariant. Nationally, there are unprecedented numbers of pregnant patients that are ending up in the intensive care units across the country that has never been seen this way before. Vanderbilt and Nashville, I believe, they said they usually only have one pregnant patient in their ICU per month, and currently they had over a dozen in their ICU. Duke has seen the same thing. UAB and Birmingham, Alabama, same thing. They're all saying that they're becoming overwhelmed with pregnant patients in the ICU. So again, it's one of those things when you're pregnant, your immune system is a little less, and so you're more susceptible to illness. Same thing. That's why we recommend getting a flu vaccine during pregnancy, because you can become very ill with flu. Now that we feel that this is a safe vaccine, I definitely encourage pregnant patients to get their vaccine. Yeah, I think initially when it first came out, there was some concern, and I know our ACOG was hesitant to say that it was safe, and now with the CDC V-Safe registry, they've had over 130,000 pregnant patients that have had the vaccine, with showing no evidence of any increased adverse effects over what would have generally been in the baseline for general population. And there were over 200,000 patients in Britain that have received the vaccine pregnant, and again that have seen no adverse effects. As OBs and women's health providers, I think we need to at least set an example for our own patients and get our own vaccinations, but we definitely need to encourage them to get their vaccinations. And I believe it's really a standard of care now to offer that to your patient.